I'm Chief Operating Hospital for Apollo Hospital based in Gujarat. We are a tertiary care hospitals and we manage patient on a center of excellence basis. Patient engagement 2.0. How healthcare providers like us can take patient engagement to a next level. Virus is in the air. Now we are having a third wave in the country and the fear psychosis is on. So health industry is moving beyond core patient services to the next generation of engagement. So many platforms are there that are seamlessly span the entire patient life cycle to help improve healthcare outcomes. So many hospitals, many healthcare providers attempting to do various technologies in order to engage with the patient because of this virus nobody is coming down to the hospital for the planned surgeries. People got a fear, say for healthcare services not reaching to the different places. Now from our physical consultation from OPD have changed to virtual OPDs. Now most of the people want to consult a doctors on a virtual platform. You must have seen so many startups have come who have started the virtual consultation. We at Apollo connected to our patient through Apollo 24/7 across all our hospital in each and every city we cater. Home healthcare, which was not happening few years ago. Now every hospital, every healthcare provider is talking about home healthcare. And if you see in this pandemic, most of the cases is not coming to the hospital because they're not very critical. So now home care is the solution. Patients are doing home isolation quarantine and they're treated well at the hospital. We at Apollo have also started home healthcare where we used to send a kit to the patient houses. They take care of themselves through that kit. Our staff nurses, doctors are available on a virtual consultation mode and patient is getting streamlined. So therefore, the request for me to all the people is that change the way you work. This COVID have changed the world. Why can't we at healthcare provider change the way we practice healthcare delivery and at the same time connected to the patient words? I'll share you few of my thoughts which will help how to keep the patient engagement throughout the life cycle he is there. So increase adoption of technology in healthcare. If you see in the year 2018, the technology adoption is bare minimum. You can see, the use of AI, you can use of technology. And now 2022, see the increased adoption of technology is happening. Thanks to pandemic. Pandemic has changed the situation, changed the platform, and we are using this technology to the maximum extent. Now, if you see AI cameras, they are the intelligent solution to our patient experience. It can be used for human resources to capture attendance. It can be used for the employee satisfaction index, our guest relation, feedback from all the guests, customer happiness index, and also some patients who are not happy, we can also manage through this. Operation management, security, management revenue, and all those things. So therefore, I think we have to use AI in almost all the platform in the healthcare. But if you see the current situation, most of the hospitals are not making use of this technology. I'll give you some example. In some of the hospital where I was working, we are using AI cameras to capture the attendance of our doctors, of our patients, of our staff. So whenever these things are coming, say for example, I'm going inside the OPD. So AI camera capture my image. There is no punching which is I'm doing. And I can also see the happiness index of a doctor or a staff. Suppose I'm entering into the morning with a 70% happiness index. And while I'm going out in the evening after my consulting time, so my happiness index is going down. So I think we can use this AI camera technology for the betterment of our employees and doctors. We can also use this technology for the patient care. Say, for example, this camera installed in one of the OPD, and a customer care manager is seeing the emotion, whether patients are happy, whether patients are sad. So if some of the patient you see who's not very happy or sad, a customer care executive will go close to the patient and ask, I understand you're not very happy. How can I help you? So if we use this technology, I think we can have a better patient engagement and a better satisfaction index. RFID into the healthcare. If we use RFID into the healthcare, it will change the way we work. If we tagged various medical equipment, patients, so we can track whether patient is in the ward, in the ICU, or the operation theater. So say for example, now ventilator is used most of the time. Ventilator used most of the time in most of the ICUs. It has to move from one ICU to second ICU. If we tag all our biomedical equipment, so wherever it is available in medical ICU, surgical ICU, and so on. So we can use this technology to the maximum extent in healthcare. Remote patient monitoring. I'll just show you some video which will be talking about how this remote patient monitoring can be used. Just so these are the technologies which are there to take care of patient while they are at home, and this kind of RFID technology can help to monitor the patient, because all the patient does not require a ICU bed. All the patient does not require a hospital to come in. Say for example, wearable devices, smart watches. So urgent message is going to the doctors. So all the platforms can be used to use these urgent messages to the doctor. Doctor can even send prescription update, personalized messages to an individual or a group. So we use these kind of technology, I think patient engagement to the highest level, and we can take care of patient while not actually physically meeting the patient. There is one experiment which was done in the hospital, in one of the hospital in Bangalore. So what we did, you must be seeing there is a patient or the nurse in the patient room. There is a nurse call system, and the very fact the name is that whenever you press the bell of a room, in your room, a staff nurse used to come, whether you got a housekeeping problem, you got a F&B problem, or a maintenance problem. Always a staff nurse has been called, and most of the time her services may not be required by the patient. So when this system was installed in one of the hospital, we have seen a 33% of the time nurses we can save on the work which is required for the patient care, not for maintenance, not for F&B, and not for any other activities. So this is a 4-point system where if you require F&B, you press that button, escalation will go to a F&B executive, and with the TAT of 10 or 15 minutes, he is coming and giving his services. By chance he is not coming within 10 minutes, this escalation will go to F&B manager or a CEO or a manager of the hospital, so that you can track when this services is given and when it is given. Similarly for the maintenance as well as housekeeping. So it improve your quality of service, and it improve customer satisfaction, manpower efficiency. Also analysis you can do, you can optimize the staff accordingly, and it is a very good operation excellence tool, and it is a plug and play based system. Say for example, a magic motion, so making waiting time enjoyable for the patient. I'll just show this video, you can appreciate. So waiting time in the pediatric OPD are very painful. See, whenever a parents take the children to the OPD, it is very difficult for both the parents and the children to wait while they're waiting for the doctor consultation. So here's the magic motion, a ceiling-based projector for the games to be played by the children while they wait for the doctors. So it keep them physically active, it keep them engaged, it keep the parent also satisfied, and it also improve the OP satisfaction index. So these are the things if we do, it is making waiting time enjoyable for the patient, and the children also get engaged in the activities. Now, tackling waiting time in the outpatient areas, queue management system. See, now you must be seeing, whenever the patient is waiting for the OPD, a typical, so many contact points are there. You go do the registration, so many forms given, talking to the patient care executive, and then you are waiting for the doctor to see you, depending upon the load, depending upon the queue which he is seeing for the specialty consultation. So if we now patient care management 2.0, if we install queue management for the patient, so there is no need for the front office manager. You book an appointment on an app which is given to you. You come down to the OPD, and various big screens are kept into the hospital outside the doctor chambers. And whenever the registration is completed, you are waiting for your turn, and names of the patient or a UHID number is shown. And whenever you go inside, it comes on the screen. So high revenues, full capacity utilization, lower manpower costs, less OP staff needed to guide the patient, higher patient satisfaction, because if they know their waiting time is 10 minutes, they can go out, have some cup of tea or a coffee, and doctor can see them. And these kind of system also give you a business intelligence report, which is very, very good for the business point of view to manage the operation. And it give you a bird's eye view of the OP appointments, trends, and pattern, so that you can allocate these many hours for the doctors. You can introduce new doctor into the system. Whichever specialty OPD is not going, you can always change the schedule, and so on. And now bundle of joy of antenatal as well as a delivery packages. So you see the number of contact point. Whenever somebody is coming to the hospital for a mother and child OPD, she has to come for 9 months for various fetal scan, for a doctor consultation and all. If we combine all these antenatal and delivery package into a bundle of joy, and comprehensive packages can be given pre-delivery, during delivery, and after delivery in a single financial package, it promotes transparency. It will help ease of use for the patient. No need for repeated payments, contact points and more. It reduces queues and waiting time at the billing counter. So this can also be used. This is out of box ways to capture the latest parenting tool, the umbilical cord jewelry, cord bud jewelry, and I'm sure every parent will be happy to see this kind of jewelry. So if you see the supply chain is a big thing. Supply chain in most of the healthcare setting is manual. A purchase order, indent coming from various units, a purchase order is made, and so on. Now you just see this. How can we change the world in supply chain?
This is Alex. He's currently spending his morning preparing purchase orders. He's managing 2 trade shows for his company this month, and there is an endless number of suppliers he is currently working with. All his purchase orders need to get approved by the line manager, the marketing director, and then by finance. Alex needs to hurry to get all the POs approved so that he can process the purchases on time for the shows. One of the suppliers just called Alex to let him know that if he doesn't order the panels for the stand today, he will not get them on time for the show. Alex prepared the PO for the panels already, but can't find his boss to approve it. She is nowhere to be found. She was already at the airport, travelling to another trade show with the sales team. So Alex takes a risk and orders the panels. This is Doris. She oversees finance at the company and reports on committed and planned costs. When she received the invoice for the panels this week without a purchase order already approved, she was very angry. After all, The company had not forecasted the spend. She went to tell Alex that he should know better. But what else could Alex do? He needed to get the panels ordered for the show. Alex thought to himself, there must be a better way. After a quick search online, he found Complete Order, an affordable purchase order automation software that integrates with the ERP his company is using. He sent the link to Doris straight away. Ever since the company got Complete Order, things have really improved for Doris and Alex. Alex can submit POs electronically and his line manager can approve them from anywhere. Doris sees all the purchase order requisitions as they come in, including the ones that haven't been approved yet, so she can better forecast future spend requirements. The purchasing process is now much faster and much simpler for finance and everyone else in the business. Doris and Alex are now BFFs. Complete Order has helped the business run smarter. Complete Smart Spend software.
Chain processes streamlined with the help of technology. Minimum number of touch points and you can do your work. So it will elevate the patient experiences. So these are some of the screenshot of the various app which has been made, how to send the indent, how to approve it, all through an app. So this is the dashboard. So if you see in the hospitals, most of the hospital, whenever you go in the OPD or the IPD, records. We are managing a hospital with medical record department. So many patients' files are there. So if you want to graduate from this manual based system into the electronic medical record, so you can change the way you work. So it is a digital equivalent of paper records or chart at the clinician office. It contains a general information such as treatment, medical history about the patient as it collected by a medical organization. These things makes life very easy for the hospital from 3 point of view. Number one, patient care is uniform care is given, because whenever a doctor note is written in an e-prescription way, various needs of the patient like a pharmacy or any other needs is documented, various services given to the patient is documented, so that all the services is mapped and built, and patient is also very happy because whatever medication is given to him, it is recorded. So I think electronic medical records is a buzzword. Like here in Apollo, we use TOPS. So we see the compliance rate is more than 75% across all the specialties. So this we see in OPD as well as IPD. We used to track how many doctors are using e-prescription. The same prescription which he is giving, it as a PDF document, it is going to a cell phone of a patient, and then the same prescription is gone to the pharmacy. So once he is down in the pharmacy, his bag for pharmacy is kept so that he can avail the pharmacy and medication there. And as well as in the lab, whenever a test has to be gone for, advice from the lab comes, your glucose tolerance test or your HB or hemoglobin or whichever test is indicated by the doctor, you need to go for that. So if we convert this medical record into the EMR format, I think it is very, very important. It also saves us from the court of law. And there is a saying, people don't speak, record speaks. So if we graduate from a paper-based medical record to a e-based paper record, I think it will change the way we practice into the healthcare, and healthcare provider can take the patient engagement to a next level. So I'll give you example, a few of the doctor ops and gynec doctors, we have done one study, how many the compliance of e-medical records. So if you see, it build a conversation around EMR in all key meetings. I'm selling the practical part of it with physician, with stress on medical legal safety. On a weekly or a periodic meeting with the doctors, you have to say which doctor, like say for example, Dr. C, OPD visit count was 78, EMR prescription count was 14, compliance is 18%, vis-a-vis Dr. E, who is 100% following. So this gives them a competitive advantage to the management or the people who are using this EMR. So more and more doctors come into your loop, and then you see the peer-to-peer training, troubleshooting, and ultimately the aggressive IT support with training, training, and training. So if we do all those things, we get continuity of care, shared care, cost and time efficiencies for the patient as well as the hospital, accountability for healthcare provider, medical legal safety, of course, because the records is available, and also reduction of medical error. So I think if we converse this technology like Internet of Thing in healthcare, data analytics system, if IoT gathers and share information directly with each other on the cloud, collect and record and analyze the data, and we improve the quality of care. So therefore, I think we have to use technology in order to engage with the patients. And if you see it improve patient engagement, number one, it identify the patient needs and provide a tailored services as per choice. It closing patient provider communication gap, because most of the time into the healthcare, what doctor ordered, what patient understand, what staff nurse understand, it is closing that gaps between the healthcare provider and the patient, and the reduction in healthcare costs, which is skyrocketing these days, and it improve decision making. I think if you have a data analysis, then you can take a decision which is based on data. If you see teleconsultations, if you see earlier pre-COVID times, it is less than 3%. Most of the doctors were doing video consultation. So now, thanks to this pandemic, most of the services, if I want to consult a doctor while not coming to the hospital, I can use teleconsultation. Now, after COVID, 48% of our OPD consultation is happening through a e-way. So it is a remote delivery of healthcare services. It is an interactive medication which allow patients, physician to communicate in real time while maintaining the compliance which is there. Store and forward, which also permits providers as us to share patient information with the practitioner into other location. And remote patient monitoring, which is key these days, which allow remote caregivers to monitor patient that reside at home by using mobile devices to like blood pressure, sugar, and so on. So I think this is a technology. The same thing we are doing into the intensive care. So like most of the doctors, most of the ICUs in nursing home, we are connected on an e-ICU way. So now ICU is a critical care. I see ICU as ICU. So it means in the intensive in the term of medical equipment, intensive in the term of specialties, intensive in the term of medication. So all the ICU does not have a facility where all the multi-specialty consultant can come and see a patient. So we have connected, our main hospital is connected to small EICUs in the city. So what do we do whenever the patient require a consultation from a specialist? The EICU is connected, and our critical care consultant or the specialty consultant can monitor the patient essential, the equipment part of it, the vitals part of it, and accordingly advice or consultation is given to a doctor who's located in a remote location, tier 2 and tier 3 cities. So while patient is there into these cities and ICU, he is getting a consultation from a specialty doctors. So I think EICU is a way which we at Apollo have started in a very big way. Now, if you see blockchain into the healthcare, I think blockchain into the healthcare is a coming discipline which will distribute the system recording and the storage of transaction record. I think it is shared immutable record of peer-to-peer transaction, which is built from linked transaction blocks and stored in a digital level. So I think this blockchain can change the delivery of healthcare. Now, artificial intelligence in healthcare, it is using in pathology. People are using in radio diagnosis. So it is quality and efficiency in radiology can be brought in by using AI into the healthcare. Various companies are there which is giving this software. If we can use this, the kind of workload radiologists pass through, we can able to use this technology in giving the radiology report at ease all the time. So now these are the things which is available into the healthcare. So I also want to focus on fever cleaning. say for example, now with the help of this pandemic, healthcare delivery has changed in a big way. So now most of the hospital are having a filter clinic or a fever clinic. Anybody which is coming to the hospital, he or she need to be screened by a fever clinic. So once he's passed through a fever clinic, like say for example, most of the surgeries or a procedure if somebody is doing, so because of this COVID, some doctors, some hospitals are doing RT-PCR test. So if we ask the patient to pass through a fever clinic, understand what is his prognosis, and accordingly a treatment is given. So what I feel, use of technology is very, very important in this new era. Therefore, patient engagement, if we graduate from 1.0 to 2.0, I think healthcare provider need to change the way they work. The patient care management model by using technology, if we use this technology, it will help us in better clinical decision, good amount of revenue, and accessibility. Now, tier 1, tier 2 and metro cities are bridged. So if we use technology into the healthcare, so we can see, like most of our referring doctors, most of our doctors who want a specialty consultation, we connect our specialty doctor with these small cities, and they're getting a specialty consultation while they are residing in their own city. So thank you very much. I hope we may use this technology for the patient care and while connecting with the patient all the time.
For more updates from CXO TV, please like and subscribe to our channel.